So good afternoon to everybody. I'm sure it has been a tough morning listening to so much new terminology which comes with IT. And I think as doctors and as multidisciplinary teams, we are here to share a lot of ideas. So I would urge you all to just keep looking at the screen for some time so that you get some familiarity with some keywords. And since CDAC is a national level organization, we have a lot of products and technologies to bring. And this will give you, the idea behind this talk is really to give you some new dimensions for thinking as to how IT tools and technologies can be used for healthcare. So you may not really remember everything, but you will have some new ideas which can be generated. So if we take a look at this particular beginning, what we are going to discuss really are dimensions related to healthcare and a basket of IT solutions which can help make our lives easier as doctors, as patients. So we have looked at a lot of dimensions in terms of the stakeholders involved, in terms of the healthcare locations, in terms of healthcare continuum. So we must be wondering like what is the need for so many kinds of health solutions really, and where does all this different terminologies fix in terms of giving us something impactful, something useful. What are the aspects, what are the modes of delivery, what are the care mechanisms that we have, and the diversity that we have in our nation is a lot actually. We will experience this diversity once we change the state as well. So here since yesterday we have seen a lot of variety of diversity the moment we landed in Chennai and we came to Vellore. So the same thing applies even in the healthcare domain. So right from the fact that we have Ayush systems, we have allopathy systems, we have yoga systems. So as a patient, it really becomes difficult sometimes to make a choice as to what systems we really want to have. So from perspective of impact, we are also seeing that there is a lot of conversation related to impact that these IT solutions are designed to have. So one way to make a choice is to understand what are the impacts that the health technologies can have. So the impact, like the first presentation by Andre, he also focused on what are the outcomes, what are the processes that will improve, is there efficiency for the doctors, is there better care for the patients. So patient is at the center of the entire discussion that we are having today. The other important point is these technologies also can have significant impact on human life by providing better healthcare, better quality of healthcare, quicker healthcare, healthcare at a lower cost. So these are some of the things which we definitely can think when we are designing solutions for healthcare. Now we will look at the basket of IT solutions which CDAC is bringing. We bring a lot of platform-based solutions, and I would also like to share with you that we have a good stall behind, and that stall we have many CDAC colleagues who are manning that stall and explaining the actual details of all the technologies. So I would urge you also to visit the stall so that whatever area interests you, you can actually see the live products being demonstrated. So one, in terms of health platforms, what we are looking at are health products for the Ayush sector. I'm quite sure you understand what AUSH actually means. So it stands for Ayurveda, Yoga, Unani, Siddha, as well as for homeopathy. So these are the areas which Ayush focuses on. So in addition to allopathic systems of usage, we also have Ayush systems for which platforms are required in our country. Then there are also public health platforms which are required. So the government is also looking at handling specific areas related to malaria, related to tuberculosis, where the action needs to be taken at the population level. The other areas are related to the instrumentation, where CDAC also has a couple of patents in this area, and we also had a detailed discussion about the health standards. Then the mobile platform and the web platform are also very useful because the mobile apps are very ubiquitous. A lot of mobile apps have come up and they give us solutions which can be used at the point of care. Then a big discussion which we also need to have when we talk about artificial intelligence are the hardware platforms which are required to develop AI solutions. So CDAC also brings what is called as the high performance computing, which is very much required for the development of building of models. So to make it sound easier, HPC is nothing but lakhs of computers. When they come together, then they make what is called as an HPC system. So instead of developing the models only on your laptop or only on one computer, you have lakhs of computers, the processing power of lakhs of computers available to you. The other important thing which we discussed is about capacity building. So how do we educate the patients, how do we educate the doctors to make optimal use of this technology? So if you look at the healthcare continuum, then you will see that there is this preventive and promotive care domain where we need to focus such that before the patient falls ill itself, we are able to give him some pointers. Then is the traditional medicine space and the disease surveillance and control systems. So the promotive and preventive healthcare is addressed through our product called as eye care at home. The traditional medicine is handled through IUsoft. So we have demonstrations of these products available. You can look at the detailed features of these products. Preetham is going to help us understand these products, as well as her teammates are also there. Then we also have surveillance systems for malaria and a surveillance system for TB. TB monitoring and malaria monitoring and surveillance are also important IT systems. These have been provided with the mobile apps which can be used by the health workers in the field, and we have seen during deployments that they are very easy to use and people are excited to collect data through this mechanism. And like we know that AI is driven largely by data, we understand that. So collecting data through these apps becomes very critical before we can build solutions targeted towards malaria, targeted towards tuberculosis. MDOTS Plus is a system for tuberculosis treatment adherence. Then we also have solutions for malaria, TB and tongue analysis, which means the images that are taken, the blood slides that are collected, the sputum slides that are collected, are we able to quickly analyze this? Because one very big challenge is the analysis itself takes a very long time. So for the result to go back to the patient, the cycle is more than 15 days. Until that point, the basic treatment of malaria is over. So the very need for doing lab testing is defeated. So how can we do it faster? Can we have AI models to enable us to do this kind of testing? Then the telemedicine platform is also, which was recently mentioned in the Man Ki Baat program by the Prime Minister, is the e-Sanjeevani platform, and it was also demonstrated how this platform is being used both by doctors as well as the patients. So interview of a doctor of Northeast was given during the last Man Ki Baat, so you can refer to the website which is given here. Then e-Sushrut also is an HMIS which is developed by CDAC, and it is also connected with e-Aushadhi system as well as e-Raktakosh for the blood management. Then the other very important area for research is the high performance driven drug repurposing. So we also have demonstrations related to the bioinformatics drug repurposing research which is being done in a large scale at CDAC. The importance of this was felt during this COVID time, and we can see the Ayurvedic plants which are mentioned below here, which are the Giloy, Ashwagandha, Pippali, Kaduchiraita and Yashti Madhu. So a research was done on phytochemicals which are derived from these components, and a lot of us have used what are called as kadhas at home for during the COVID area. And can we really see what is the molecular basis which makes these herbal medicines prescribed by Ayurveda work in the real life. So these are the things which we are able to see through this analysis based on high performance computing. Then two very important resources are provided for the usage of this system to the end users, and a lot of tools are provided already which are as follows, which is Anvaya, Gamut, Tango. So details of these tools can be explained by our colleagues at the stall, and it is very interesting to see how the bioinformatics pipeline is important. And also I noticed that in CMC the bioinformatics unit is very new and they will benefit from the usage of these tools and technologies. Especially if you go and search the web, hundreds of tools are available for bioinformatics, but in the form of a pipeline, if those tools are given, then the utilization of those tools is much higher and we take much lower time to reach an analysis and do research quickly. So this becomes useful for our research work. Then the other is the development of what is called as e-Sadhya. This system is a e-learning framework for, there was also discussion about what are the tools and technologies for people who are differently abled, so who are not able to function normally. So this is also one of the very important tools developed for mental retardation and autism. So this product also has been brought here for demonstration. Our Bangalore team will help us with these products. The other important tool which is also released all India is Manas. So this tool is a mental well-being initiative also developed in Bangalore, and all these tools when we develop, we also have linkages with hospitals. For this particular case, we also have linkage with the mental health hospital, and the domain inputs are very much required to help us to develop these tools. So there is a citizen app, there is a platform, as well as Manas, with lot of webinars are conducted to help the users for these applications. Then we obviously know that there's also, I heard that a community center with CMC Vellore. So the community centers, the hospitals, the rural hospitals, lot of NGOs, and public health is also a place where public places is a place where we can demonstrate the preventive and promotive health aspects using these tools very well. And we also have several publications in this area, and I hope that we've been able to learn and understand about a few tools which are developed for the healthcare. We will also take a look at in detail about what are the technologies developed for oncology in our talk tomorrow. So if you have any queries, please feel free to ask. Thank you so much.
They also support the research institutes.
Yes, they do. Yes. So there was a very important question, like HPC services for research, are they provided by CDAC for research institutions in India? So yes, very much, lot of research institutions are collaborating with CDAC and using the BRAF facility which is given by CDAC for doing a lot of research work. So please feel free to connect so that access can be given to you for this BRAF facility. So it's a very good facility, and you will find lot of tools also available which can be used immediately for your research work.